Everett Bone Joint Orthopedic Surgeon Dr. Howard Barker is with us. How are you, sir?
I am great. Thanks for having me tonight.
Been a long time. Now, we wanted to have you come on. It's the 4th of July. There's a lot of, summertime injuries that happen. Kids are out of school. They go out, come back. They fell off the pool or whatever that is. So,
all kinds of injuries. One of the things that I often do personally to myself is, we all of a sudden the summer the heat comes out and we're running around with no shoes on. And here's an example. Just a couple of weeks ago, I stepped on a stick in my yard and jammed the stick in the bottom of my foot. Now, you're a foot specialist, so that's why I'm talking to you. And, pulled the stick out. It was a little bit of a bleeding and a puncture wound on the bottom of my foot. But towards the end of the evening, it started getting sore and sore where I had difficulty weight bearing on it. The next day, I went to work, and one of my therapists was looking down there because I asked, because you can't see the bottom of your foot, And so they pulled out a chunk of bark. I embedded a chunk of bark in there. Now, what would happen if I went and got that little chunk of bark out there?
Pus.
Oh, yeah. So I would have had a little reaction, huh?
Yeah, I get an infection. And, my kids will tell you I'm always screaming at them to put shoes on. Running around without shoes is dangerous.
Yeah, being a foot doctor, you see all kinds of stuff. What kind of stuff do you see in the summertime with all this barefoot stuff we have going on?
Well, at the break, we were talking about how many people are stubbing their toes and breaking their toes. And although it's just inconvenience and painful, it doesn't really usually cause too much harm. It hurts a lot.
Yeah, and if you fracture your big toe, particularly you're in a pair of flip-flops and all of a sudden jam it, what is that fracture going to feel and look like? I know it's painful, but how do you know you fractured a toe? And the rule of thumb is you really can't do much about a toe fracture, can you?
Well, sometimes you can, and sometimes you need to earlier than later, especially if it's of your big toe. But fractures show up as pain. When you stub your toe, it always hurts the first little bit, and we all have felt that. It hurts like crazy. When that hurts like crazy keeps going on and you get big and swollen, especially if it's purple, then you got to think that it might be broken. Now, the real key, if it's crooked, it's broken.
And if it's crooked, and mine was crooked, I did this 2-3 years ago.
Yeah,
it was crooked. It was nasty looking. Do you have to have that set and straightened out? And is there any metal going in your toe?
Most people straighten it out themselves. It's awesome.
Isn't that
they
what
grab their toe, they pull it back, and they
popsicle
tape
stick
it together? Sure.
Yeah, popsicle stick.
Sure.
The old Boy Scout.
Yeah.
But if it's through the joint, especially of the big toe, sometimes we go fix those. And there's some fractures of the big toe that we'll fix with metal more so than the other toes.
Interesting. So, that big toe is pretty important. People don't realize it's a pretty important little appendage. I mean, you have to roll up on that toe, and if it's painful, you're not rolling up or you're not walking right.
Ask Deion Sanders, right?
Absolutely.
That ruined his career.
Turf toe.
Turf toe, that's right.
Yep.
And
Turf toe. And what is turf toe? Is that we've talked about this before, right?
We've talked.
Just like a bad sprain of your toe, right?
It's a sprain of the plantar plate, the bottom part of the toe joint, of the big toe joint.
Wow.
And that bottom part of the toe joint has a couple little bones in there called sesamoid bones.
That's right.
And those are pretty important because they kind of protect that tendon and kind of form a trough there. Can you fracture
You guys
those?
are showing off right now.
No, I'm just
Sesamoids are kneecaps in your toe.
Yeah, exactly.
And,
kneecaps in your toe.
yeah, okay,
Good point.
I know exactly I know what you're
They're
talking about.
kneecaps in your toes,
Yeah.
and if you break them, it's a pain in the patootie, not just a pain in the foot.
Yeah.
It's so long to get better from that.
Let's go back to his bark in the bottom of his foot. Should he have gotten a tetanus shot for that?
Well, if you get any type of puncture in your foot, especially if it's metal, but if you get any type of puncture, you should be thinking if your tetanus is up to date. Tetanus can kill you. We shouldn't mess around with things that can kill you.
What is up to date?
I think it's 5 years.
Every 5 years?
But I can't remember.
See, that's the
That's
thing.
a good segment. We'll have to have that on.
That's the thing
I'm
with
the wrong
tetanus.
guy.
Everybody wants you to know it's up to date, but nobody knows what up to date is.
Yeah,
Your family physicians-
Your primary care physician
Yeah.
does.
And
And what
family
happens
physician's
when I
gonna
ask my primary care? He automatically gives me a tetanus shot again,
that's okay.
whether I need it or not.
Thumbs the word for you
Yeah,
then, huh?
totally. I know.
Yeah. So, that's something I didn't even think about. It just, I had a chunk of bark in my foot, and I just yarded it out, and everything moved on. But I cleaned it. But how would you know if you, stepped on a piece of glass? Swimming, you go to these lakes, and there's bottles in the lake. I've done that, too, where you jump in the water, and you're in the mud of the lake bottom, and all of a sudden you cut yourself. And, that can be nasty, too.
Those are nasty.
You see that?
Yes.
A lot of lacerations? And
I see that especially when I'm out with my church group, and there's 120 14 to 18-year-old kids running around, and somebody always gets cut.
You're on duty.
I am. I always have my sewing kit with me. So it's very common for a toe laceration or the bottom of the foot laceration.
Well, it's just little things like just those lacerations. Even if like you had a lake and there's a nail sticking out of a dock or an old ladder that has a nail in it or a piece of wire or something like that, and you scrape that again, that has to be watched. And again, the old tetanus.
Yep.
Tetanus. So there it is. The word on the street is tetanus.
Tetanus. Make sure your tetanus is up to date. Howard Barker's with us from Everett Bone Joint. What type of injuries do you see in the summertime that you don't normally see in the wintertime?
We see all type of injuries
Yeah.
all the time. I mean, we switch sports, right, from skiing to water skiing,
Right.
snowboarding to wakeboarding, and baseball around here runs full time. So we still keep seeing them. The 4th of July is a reminder that from an orthopedic standpoint, fireworks are stupid.
Yeah.
People lose fingers, they lose things, and we were busy on the 4th of July. And that's dumb. We shouldn't make an orthopedic surgeon busy because of a holiday.
Right.
Yeah.
See, I was raised by parents who thought fireworks were dumb, so I didn't really have a lot of them. But I knew a guy that had fireworks blow up in his hand.
It's kind of a
Stuff like
rough
that.
holiday to be on call.
It is. And the other thing that makes it so difficult is the amount of alcohol that's consumed, to be honest, because people get drunk and they do stupid things, and we do stupid things. You break more things and you tear more ligaments, and more ACLs are torn and all sorts of that stuff. So it's, you have to watch what you're doing when you're kind of had a few.
Yeah, absolutely. So I mean, when you have a few, your judgment is impaired.
Yep.
So you might, if you're holding that firecracker too long and that thing, because some of those things have pretty short, quick fuses. Have you seen some fairly significant hand trauma then?
Yeah, but as we can, talk about the other types of injuries, I have very many ACL tears from people who are drunk,
Okay.
playing kickball, drunk.
And
They're just impaired, and they're not running or doing things they ought to be because they can't run straight.
yeah, good point. Good point. So that impairment, once again, is going to affect other
It's
joints.
a theme that's happening
Yeah,
in
it
this
is.
show, huh?
4th of July.
The 4th
I thought
of
it was
July.
hamburgers and potato salad.
Yeah, no.
We're here now.
It's injuries and DUIs, basically,
yeah.
is what it is.
Yeah, so the ACL is, it's a little bit of a recovery process for a little bit of a
Now let's
lapse in judgment,
Long
huh?
time.
Let's talk about water skiing safety. You're a water skier, right?
Yeah, I enjoy water skiing.
I love it.
Oh,
Yeah.
you do as well,
I
then.
love it.
Okay, so here's some tips for water skiing. Always wear a life jacket. I didn't know that. You're supposed to wear a life jacket
yes,
water
yes,
skiing.
yes,
I
yes,
don't
yes.
water ski. Do strength training to prevent knee and lower extremities injuries.
Absolutely.
Do people do a lot of that?
Do they do the strength training?
Yeah.
No.
You have to be in excellent shape to.
You never water skied.
And it
No,
is hard.
Okay, yeah.
Water skiing
It's-
is physically
Yeah.
demanding.
Yeah.
You have a
I've
boat
never
that's
water
going you
skied.
40 miles an hour, and you're
It
going
is, yeah.
around
The
a course.
boat's got you going, and you're. I mean, a lot of the place that I always feel at water skiing is my low back. For some reason, I get really tight water skiing because you're stabilizing your core so much, and the boat's pulling you, and you're kind of pulling back on the boat, and the other thing I've seen a lot water skiing is hamstring strains. Because it seems like when you come out of the ski and it's going to pull you forward, it rips that hamstring. So, yeah, strengthening, flexibility. It's a sport. It's a vigorous sport.
So stretch
Yeah,
is
absolutely.
very important. Use a tow rope with plastic or foam coating to reduce lacerations.
As I looked at that earlier, I was thinking the most important thing about your rope is that you don't wrap it around anything.
Yes.
I have a friend that lost his arm because
Oh.
he was double skiing.
No,
with
come
it.
on.
For real.
Really?
Yeah, he was teaching his girlfriend how to ski. And so he had a 75 and 100-foot rope, and he had the 100-foot. So he wrapped. He's an expert skier. He wrapped his, he coiled up his 100 to make it a 75. Got up, but then fell, and there's
Yes.
arm.
Yes,
Yeah.
you don't even think
Above
about that.
elbow amputation.
And you know how that's so common. And when you first come out of the water, the natural thing to do is hook the rope in
Yep.
your elbow and then straighten out and get all. Yeah, so avoid that.
Don't you just put that in milk and then you take it to the doctor and sew it back on? It doesn't work like that?
My gosh.
Yeah.
So never wrap a rope around yourself when you're getting pulled by a
Okay,
boat.
that's good. I would never have known that. If you're a novice, have the boat pull you at a slower pace. That makes perfect sense, right? Use skis that are fitted to you. The binding should be snug, but will release if you fall.
Absolutely.
So if you fall down, the skis float up. What happens if they don't? Then you're like,
You find
Oh,
them.
they float.
You
Okay.
find them on someone's beach.
What happens if they don't come off you, though?
Well, you know what I've seen when they come off sometimes is the
They
ski
can
gets
hit you.
pushed in the water and it bobs
Oh,
back
it smacks
up.
you in the
It
face?
can hit you in the face.
I
You
have a
get-
nice scar right above my
From
right
that?
eyebrow from a knee board.
Did you sew that yourself?
No, I had my brother.
Yeah.
Sew it
Wow.
for me.
Is he also a doctor?
He is.
Oh,
Yeah,
good. That's
family.
good to know.
It's nice
No, he's a sewer.
Nice to hang out with.
Never
a
ski at
group of
night in
physicians.
shallow water or in front of another boat. That makes perfect sense. Skiing at night must be something that you would do on the 4th of July, drinking
Drunk.
all day long.
Yeah,
right?
exactly.
Exactly. Yeah. Have you ever seen?
Just hold the lighter. It'll be okay. What?
A nasty injury, and I've rehabbed a couple of these over the years. Is someone that gets in the prop
Yeah.
of a boat. That's pretty wicked. You ever seen that?
Yes, and prop injuries are terrible. They chew you up so badly and over so many different areas. So yeah, don't get in or out of the boat with the boat engine on.
Right.
Not just that it's not engaged, but it has to be off.
Another drunk thing to do.
Can
probably,
be.
right?
is
Can be.
off.
Generally speaking.
Wear a
I mean,
helmet to protect against head injury. People wearing
Now,
helmets.
Come on, I've never read that
When
or
you're-
seen that.
it's
I've
right
never-
here.
have
It
you-
says-
Has anybody ever seen?
I was just gonna
a
say, do you
water
wear a
skier
helmet
with
when
a
you go water skiing?
Have you seen one?
I have not, but you know what? It's not a bad idea when you look at, the skis and going forward and things like that. I mean, 10 years ago, did you ever see a helmet snow skiing?
Now, yeah, but we can have a debate about that too,
Okay.
because there's studies show that it doesn't decrease injury. In fact, it may increase because people feel more
Get more
safe
comfortable,
with it
but
on.
Just like the
and
NFL.
and they do higher risk activities.
When you
Good
were a
point.
kid, did you have bike helmets? No.
It's a segment.
We didn't have
It's
bike
a
yeah,
segment.
but bike helmets, I'll fight you. They save lives.
Oh yeah, absolutely. See, back in that I always say that's why there's so many idiots now, because when we were
It's true.
kids,
They all
it was
died.
survival of the fittest. They didn't make it. Now they were saved. So, common injuries you see: wakeboarding. What's wakeboarding?
It's a single ski that's 90 degrees opposite. So it's like snowboarding for
Yeah.
water skiers.
Oh, okay. And you ankle sprains, ACLs, tears, MCLs.
Well, like snowboarding,
Sprains.
wakeboarding, because a lot of times when they go down, I mean, they're going to try to stop their body with their upper extremity. So I've seen a lot of dislocations of the shoulder because you're going fast and you're going down, the arm's out, and the water pulls your arm back, and socket comes out forward.
Also, experienced wakeboarders are doing crazy things.
Yeah.
They're doing backflips and 360s and stuff, whereas
Helmet.
water skiers are doing, crossing the wake at extraordinary speeds, but they're on the ground most of the time, unless they're jumpers.
There you go.
Wow, good stuff. All right, well there you go. It's Dr. Howard Barker. Thanks so much. I see. That's why I don't do anything. It's I don't do anything. I'd rather watch it on TV. To be honest with you.
Oh,
Got to get
Rather
out
than-
there.
Yeah,
we
and
missed you in our office.
As
I mean,
far as
come on.
as far as getting like cuts in a stream, public swimming pools, you won't run into that.
You can water ski.